Hello, hello. It is 1 o'clock here in Northern California, and I am waiting for my guest today. It's going to be a very special Instagram Live. I will be talking to Dr. Sadaf Lodhi, and she's an OBGYN and a sex coach, and just waiting for her to come on. And as soon as she is on here, we will start. So great to see you guys. Hi, Karen. Hi, Rachel. Hi, Grace. Hi, Clover's 3. So good to see everybody. Hi, Doc. All right. Okay, I am going to invite Dr. Sadaf. Rachel, Romero Louise.
Hi, how are you? I'm
Hi.
doing great.
Hi there. I'm good. How are you doing?
Yeah, I heard about that big
You guys
storm,
are having
right? It's
better
like a
weather than us
cyclone
out
or
here.
yeah.
Yes, it is. Yes, bomb cyclone or whatever. Yeah, so it is. It's a little bit crazy. But thank you so much for joining me today. Really exciting. And we have some folks joining us, and thank you all for joining us today. This is a very exciting Instagram Live. We have Dr. Sadaf Lodhi here. She is an OBGYN and a sex coach. I'm going to let her introduce herself in a minute. But for those of you who are watching, or maybe you're watching later, if you're watching now, please say hi. If you're watching later, please hit hashtag replay. And I'm Dr. Cheruba Prabakar. I am the Fibroid Doc. I'm a practicing OBGYN here in the Bay Area in California. And today we are going to talk about sex. And I am so excited for this because this is a topic that is not talked about a lot. I'm excited to dive into this. And so, Doctor
Yeah, well,
Lodi,
thank you
thank you so
so
much
much
for
for
being
having me.
here.
I really
Please go ahead
appreciate
and
it,
just
and I'm
introduce
really
yourself.
excited to talk to your viewers and excited to have this conversation. So, just a little bit about me. I am an OBGYN. I practice in New York, and I did my training out in Michigan along with my medical school and undergrad, and came out to New York, and so now I'm here.
Awesome, great. So, in our culture, just in the Western culture in North America right now, when we talk about health, somehow sexual health is kind of hush hush or kind of pushed down all the way in the bottom. I know when I ask patients, "Hey, are you sexually active?" Sometimes they just
Yeah,
like
I think that
avert
people
their
are,
eyes.
I
Why do you
think
think that
it's
is?
well, first and foremost, I think it's a lot of this cultural cues that we get, in society, in media. When you see media, right, sex is all over the place. But in general, in conversation, it's really not a conversation that most people have. And I think it also has to do with the culture that you grow up in, right? So if you are say from like more of a conservative culture, I think
Sure.
that you're going to be really hesitant to talk about something as intimate as sex, right? And I think that it also has a lot to do with like sex negativity that people grow up with. Oftentimes people think it's taboo, it's embarrassing, it's shameful, and so then they don't definitely, are very hesitant to talk about it amongst, friends, but even like with their healthcare providers, right? And so we would hope that as our patients come to us, and especially talking to OBGYNs, as both you and I are, that they would feel more comfortable talking about it. But I find that patients are still very hesitant to talk about it.
Absolutely. I mean, you mentioned culture. I grew up in India for the first 12 years of my life. And over there, just at least growing up back then, it's not something you really talked about. we
Ah,
talked about, cultural can also be just religious culture as well, right? There's a lot of religions where, hey, like, just don't talk about that. I think probably all religions now, but even living in America, living in the West Coast, living in one of the most liberal cities, in California, even here, I feel like in general, people are not talking about it. So I think we have a long way to go because after all, sexual health is health. We don't hesitate to talk about high blood pressure or diabetes,
ah,
but I think you probably had a similar experience, but in
absolutely.
medical school, even like I don't think I learned anything
Yeah,
about, just the basic anatomy, for a 30-minute lecture. I don't think we learned anything else more extensive, right? There's a lot of just self-teaching and reading and um, kind of
absolutely.
through those
Yeah.
avenues, just learning
Yeah,
more for
yeah,
ourselves and our
absolutely,
patients.
100%. So,
I wonder
in
if you had a
I went to
similar
medical school at
experience as
Michigan
well.
State, and I love the school, but definitely we didn't learn very much at all, if anything. I think maybe the only thing we learned was the Masters and Johnson, theory that they had on sexual arousal and orgasm and plateau and things like that. And that in itself, I think, was maybe like a 2 hour
Hmm.
lecture, over the 4 years of medical school training that we get. And then even as an OBGYN, I mean,
Yes.
I don't know, you can tell me about your experience, but me during my residency, and I did residency again in the state of Michigan, I didn't have much training at all. I mean, like nothing on sexual health. And so then, as you know, when patients come to us and ask us
Right.
questions, where are
Right.
we supposed
Right.
to get the answers? We just like, I don't know, unless we yeah,
Absolutely. It was almost like it's almost like that was extra, like sexual health. Oh, that's just like
absolutely.
extra. Like, let's just take care of the big important things right now, you know? And, I get it, it just depends on where you're practicing and where
Of
your
course.
population is. I mean, there's more life and death situations that are happening, and we're trying to take care of that. But we know that this also really helps relationships, helps people to stay together, help, it's just so important to discuss. So I'm thinking about the population who is like, just who are just done having kids, right? So kind of the late 30s, early 40s, and then till death, right? 80s, 90s, whatever. What are some of the challenges that you see in this population in terms of being able to either get
Yeah,
to
I mean,
having
I think we
sex,
could
either
talk about
talking
everything,
about sex
right?
or just
Like,
enjoying sex?
like I think that anyone, and I don't know if you're in that age range that you're talking about, but I definitely am. I'm definitely perimenopausal, and we have kids, we have jobs, and sometimes we have very high demanding jobs, right? And we have our parents that perhaps we're helping out or we're taking care of, or and looking after them. And so there's so many things that take priority, and definitely sex is not one of them, right? Sex probably is the very last thing. And for some people, they even think of it as a chore, right? Like they don't really even want it. And I
Yeah.
guess if their spouse wants or their partner wants it, then they do it. But otherwise, they just really don't care to have it, right? And so I think that that is actually one of the biggest things. I had
Yeah.
recently, I did a consultation with a woman that was looking into my coaching services, and she said that her husband was not on board, right? So he basically just, when he wanted to have, be intimate with her, have sex with her, they would just quickly have sex and then that was it, and then move on to the next thing that they had going on in their lives. So it wasn't really a priority.
The
And
next thing
she
on the
said she
list.
just never got any satisfaction from it, right? So if I think that one of the biggest things that we don't prioritize when we talk about sex is pleasure. And if we are going to talk about pleasure, we have to, it's not just, the male partner, if we're talking about a heteronormative relationship, it's not just, the man, but the woman also that should experience pleasure, that should want it. And, it's oftentimes I've heard people say that it's about having sex and wanting sex that is worth wanting, right? So it's if a woman is not
Yeah.
being
Yeah.
satisfied or having pleasure during that intimate moment with her spouse or partner, then she's really never going to want it, right? And it's Exactly, exactly. So then
So then it
it's
just really
really
becomes a
not
chore.
sex worth
Yeah.
wanting. And so I think that's the first and foremost thing, is that open communication with your partner, right? And that's where it all begins. And I think it's a pretty difficult conversation to be had, right? So especially if you've been married to somebody for like, say, like 18 years and you've never talked about sex and you've been miserable the whole time. And then all of a sudden you decide
Yeah.
to bring it up and then they're going to be like, well, where's this coming from, right? Like, what the heck? You never mentioned anything. But that's the thing, right? So we have to bring up our own needs and our wants, and that's where the communication comes in. And that's why it's so important to have these type of conversations with our partners, so that we
Right.
too can enjoy, you know, the intimacy, the sex part of a relationship.
Yep. Absolutely. And I mean, as you said, in this age group, women,
Yeah.
a lot of women have had kids and then they feel like they've gained a lot of weight. They don't feel attractive. Then they've got, they're getting up in the middle of the night to, feed these babies. And they just, it's just the whole thing just doesn't seem that it's just like, okay, one more thing to do, let me add
Yeah.
it to my list. And, they're thinking about their
Yes.
grocery shopping or whatever, right? Like when they're actually having sex. But you brought up a great point. It's just not about check having sex. It's about actually, getting pleasure. And what does that look like? And that's going to be so different for every couple, every relationship. But really communicating that is where it all starts. What would you suggest is like the number one way to actually go about bringing this up with your partner? Because as you said, it's a little embarrassing maybe if you've been married for a while. You're like, oh my
Yeah.
gosh, like,
Yeah.
maybe I should just like let it go. Like, why am I bringing it up now? What are they going to think of me?
Yeah.
You know,
So,
do
you
you
know,
have a tip as
I think
to
that I don't
one
really
thing?
know if there's ever a good time or a good way to bring it up. But I think that what I would recommend is maybe having a date night, right, with your spouse. And so, you know, I was just reading a book. It's called Sexual Intelligence, which I think is great. But what he talks about in the book is that, you know, we always long for the time when we were younger and sex was more spontaneous. But what he brings up is a very good point, is that sex is never really spontaneous per se, right? Like you've been thinking about it, you've been planning it, you've been thinking about what to
Hmm.
wear, what, you know, where you're going to go eat and what you're going to do, and then afterwards, and then what the environment is going to look like. You know, are there going to be candles? Is there going to be music? Are the lights going to be down, dim, right? So you're planning it. So it's really not really spontaneous, right? So then to even bring up this
Yeah,
conversation, I think would be a good
right.
time perhaps is when you're both well rested. Right? You never want to bring up like a touchy subject when one person is, you know,
Yeah,
sleep deprived or post call or something like that.
yeah.
You know, it might be better if you're out on a date or you're going for a walk, or, you know,
Hmm.
you're just kind of chit chatting, sitting, you know, watching a movie or TV together. And then you just kind of look over and be like, hey, you know, I've been kind of thinking about something. And, you know, what do you think about this? Or, um, you know, I've been reading
Yeah,
about, you know, X, Y, and Z, and I've learned a few things, and I'm wondering if you'd be interested in also learning about this, you know, and, you know, I'd really like to experience pleasure in this, you know, scenario, and this is what I've been thinking, and these are the ways that I've been thinking, you know, what do you think? So I think making it a dialogue, you know, making it a priority. And, you know, you mentioned something that's very, very important that comes up a lot
hmm,
is, you know, we have so many things on our plate, right? We're thinking about the dishes. We're thinking about the next birthday we have to plan. We're thinking about vacation. We're thinking about bills. We're thinking, you know, about everything except for sex. And that's during sex, right? So
yes,
then it's hard to be in the mood
yes.
when you're thinking about 50 other things, right? So there have been multiple studies that have been done that have shown
Yeah.
that one way to increase desire and arousal is to be mindful, right? And so mindfulness, I know, is like this great catch-all word that everyone
Mm.
uses, but it really, really plays a huge role in intimacy and, you know, when you're having sex with your partner, because when
Hmm.
you are focused on just what you are doing, right, and nothing else, then you can really be present in the moment,
Yep.
right? And being
It's a very,
present in the
very
moment
good point.
leads to arousal, which then will lead to desire. And so there is, you know, something else, I'm sure you've heard of it too, is the
Yeah.
female sexual response cycle, right? So that was created by Rosemary Basson in, I believe it was 2001. where
Yeah.
she talks about kind of a circular model instead of the Johnson and Master model, right? Johnson, yeah, Masters and Johnson model, which is more of like a linear line and then a plateau and then resolution with after orgasm. This is more of a circular model, and it takes into account the biopsychosocial aspect of a woman's life, and it talks about how different things can affect arousal and desire. And she also states that typically arousal comes before desire. And again, this is where that, you know, it has to be sex worth wanting, right? So if your needs and your desires are never met when you're doing something like that, then you're never
Mm-hmm.
going to want to have it. But if your desire, if your pleasure is prioritized, then you're going
Mm-hmm.
to want to have it. And if you want something, then that arousal will happen and then that desire will happen. And you know as well as I do that as we get older, right, our estrogen starts to go down. And so we have decreased lubrication and we have vaginal dryness. And, you know, we're a
Yeah.
little bit, perhaps we're a little bit more moody. We have some anxiety, we have some depression and all of those things. So we have to take into account all of those things, right? And so if we're having pain when we have intercourse because of vaginal dryness,
Absolutely.
then perhaps, you know, we seek out lubricants or we seek out vaginal moisturizers, right? So we know that vaginal moisturizers are for like a daily thing that we would use, but lubricant is more during intercourse that we would use. And that makes, you know, having intercourse a little bit more pleasurable. And you don't actually even need a reason to use lubrication, right? If anyone needs it, they just use it. You don't have to be a certain age or, you know, you can use lubrication at any point. And I think something that
That's right.
we have in this society, a myth that people like to say is that, well, only when you're aroused are you going to get lubricated, right? But we have something called arousal non-concordance, that sometimes
Mm.
you can be lubricated and not be aroused, or you can be aroused and not be lubricated, right? So for example, like we talked about, as women get older, and if they have, as they're starting to go through perimenopause and menopause, they may not always be able to get that lubrication. And so then they'll need a lubricant, that, you know, and there's so many out there. But
Yes.
it's important to know that
Yep.
that there's no shame in
Yep.
using lubrication, and it just helps to make that intercourse, that experience more pleasurable for a woman.
Mhm. Yeah, that is such great insight, such great information. Now, for those who are listening in or watching later, if you are in a point of life where you just don't want to have sex because you just are sleep
Of
deprived
course.
and you've just had a baby and whatever, that is also totally fine. I mean, the definition of sexual dysfunction is if the lack of sex is really bothering you or hurting your relationship and you are, you're bothered by it. But I do have a lot of women who
Right.
say, yeah, I'm not sexually active, but we're cool with that. We're fine. We do other things. We're intimate. We travel, we go to dinner, we cuddle, and that's also totally fine. But for those who are bothered by it, by those who are like, I wish, this area of my life was a little bit better. I wish there was this area of my life, I was getting more pleasure out of it. I want to think about some power thoughts that
Yeah.
women can have and act on. And I'll go first. The first one I was thinking of is, let me see if there are easily fixable things that can be taken care of that will then allow me to actually have a normal sex life. You mentioned some of these
Yes.
first, like vaginal
Yes.
dryness. Lichen sclerosis is another one that we see all the time.
Mm.
And this is a condition where sometimes the labia and the clitoris actually fuse together because it can be an autoimmune condition, but it's easily treatable. We can actually use a cream, but it has to be diagnosed. And the way it's diagnosed is by actually seeing your doctor. So don't skip out on actually going to these regular GYN exams and, bringing this up if it's an issue, if you're like, oh, this really hurts, or my vulva is really itching, or sex is painful, your
Yeah.
GYN should be able to do an exam. And I can tell you how many times I've picked up lichen sclerosis, and then we actually treat it, and then patients go on to do well and can actually get back some of that functioning. Vaginal dryness is another one that you mentioned. So lubricants are great. Vaginal estrogen is great. We all know that vaginal estrogen is overall safe for most women. Definitely speak to your
Yeah.
doctor about it. But this is something that another small thing that we can be
Absolutely.
doing to really help the quality of our lives. Because sometimes I think it can be pretty a little depressing when we think about all the ads for Viagra and Cialis and all of that, right? And there's so much research going on for men and quick medications for the erectile dysfunction portion of it. But for women, we're like, okay, where's our medications, right? But there are things that we can actually be doing to actually help out. Are there any other thoughts that come to mind where sometimes we know that mindset is so much of it, right? Like just being able to think differently and then act on it. Are there any other thoughts that you can think of for women who
Absolutely.
really would like to
Absolutely.
decide, would like
Well,
to have more
two of the
pleasurable
things that
sex, but are not having
there's so
it?
many things that, you and I could talk about. But one of the things that I did want to bring up is that there are medications for decreased desire in women. There is one, it's called Vyleesi, which is an auto injector that you do. I believe you inject yourself 45 minutes before, you think
Hmm.
you're going to have intercourse, and then that helps with arousal. There's another medication called Addyi, which is a daily pill that you would take. And again, like you said, you only take these if you find that your desire or decreased libido is bothersome to you. And it's been going on for, typically they say like for 6 months, but if it's bothersome to you, then it's worth checking out, right? And like you said, if it doesn't bother you, then that's okay. It's not a problem, right? It's only if it's bothersome to you. And both of these medications usually take like, 2 months to really start
Right.
to work and be beneficial to you. So you can check them out and speak to your doctor. And like you said about vaginal estrogen, there have been no
Yes.
studies that have shown, of course, more studies have to be done, but there have been no studies that have shown an increased risk in women that even have breast cancer. But of course, obviously talk to your oncologist before you take any type of estrogen if you have breast cancer. And of course, if it's
Yes.
estrogen receptor positive. But, when you talk about power thoughts, I think if some of the thoughts that come to mind for me is that, to tell women that there's no shame, first and foremost, about wanting to have sex. I feel that sometimes women get shamed about if they have, it's always, I feel that the pressure is placed on the woman, whether she has too low libido or she has too much libido, right? There's
Hmm.
always the issue is always with the partner
Hmm.
or, the
Hmm.
person. And I think that we have to take away that shame. We have to take away that taboo and know that, these topics should be discussed with somebody that you trust, and definitely with your healthcare provider if you have one. And if you don't, then, definitely you should seek one. When we talk about that biopsychosocial model, right? The biggest
Hmm.
one thing that I remember hearing in a lecture that Dr. Uloko, who I had actually on my podcast, she's a sex med. Do you know who she is? She's great. Yeah,
Uh-huh. Yes.
yeah, she's great.
Well, I
I
just
love
listened
her.
to that
And so
podcast actually recently, and it was
one thing
great.
I
Yeah.
remember listening to her speak one time, and she said the biggest sex organ that we have is our brain, right? So it's always about making sure that we're in the right
Absolutely.
frame of mind.
Yeah.
If we have anxiety, if we have depression, that we go and we seek out help. We talk to a therapist, right? Because that in itself will also affect our desire. It's going to affect our
Hmm.
arousal. It's going to affect our relationships. So that's why that's so important. And then when we talk about the social aspect of it, right, is looking at our culture. Where do our beliefs come in? And that's why it's so important that if you have beliefs that are not serving you, that you speak to somebody about it. And, of course, I'm going to say that a sex coach is a great person to talk to about your beliefs. And if they're negative beliefs, where do they come from? What impact are they having? And are those thoughts serving you? And if they're not serving you, can you change them
Hmm.
so that those thoughts do serve you and help you grow and move
Hmm.
forward, right? And don't keep you stuck. And a lot of times people feel that, if they grew up in a really
Yeah.
conservative society or culture, that is the baggage that we bring with us. So again, looking at those thoughts and, in case anyone that's
Hmm.
listening that, is not sure, I think one of the biggest things that I tell women is to give yourself permission, right? Often it's us that holds us back and doesn't
Yep.
move forward. And we're stuck, but we don't know how to
Hmm.
get stuck. And it's just that we
Yeah.
have to give ourselves permission. And we give ourselves permission for everything else. Let's give ourselves permission to explore and want sex. If that's something that you want, right? Explore pleasure. if that's what you want and that's what you desire. And that it's
Yep.
okay and that there's no shame.
Yeah. Yeah, this is that. Those are amazing thoughts and definitely things to think about and kind of internalize and really spend some time thinking about it because these are thoughts that we often kind of
Yeah.
tuck away into the dark recesses of our brain or our body, right? Like there's so many other things at the forefront, but as you said, giving yourself permission and yeah, I love it. So this is a good segue into, speaking about culture
Yeah.
and beliefs. You are the host of the Muslim Sex Podcast, which I just love that. So tell me about that podcast. What inspired you
So yeah,
to
thanks.
start
So
that?
I am the
And tell
host
us a
of the
little bit
Muslim
more
Sex
about it.
Podcast. If people haven't heard it, definitely look it up. It's on all of it's on Spotify, it's on Apple Podcasts, it's on YouTube. So you can definitely find it. It's available. The reason why the brainchild of it was my friend and I, one day we were talking and she is a lay person. And so she said, wouldn't it be great if, because she was asking me questions about gynecology and sex and this and that. And so I was talking to her about it. And she said, wouldn't it be great if there was like a podcast that, had this information available and you could access? And then I was like, yeah, you and I should do something like that. And so that's how that's how it came about. Actually, the name, the title, we thought of because well, we thought it was almost like an oxymoron, right? Like it's unfortunate, but that's what it kind of sounds like. Like people don't really associate like Muslims and sex, right? They associate a lot of other things, but not Muslims and sex. So, and of course it makes
Right.
sense. Like how else do we all get here, right? We have to have sex. But so that's why it's called the Muslim Sex
Yeah,
Podcast. And it's
right.
almost like it's a little bit of a shocker, right? So when you hear the name, you're just like, huh, what the heck is that? Um, so yeah, so that's how that started. And really
Yeah,
on
yeah.
that podcast, the beginning, I spent a lot of time talking about obstetric issues and gynecologic issues and a little bit about each of the topics. And in fact, I just recorded this morning
Hmm.
a year in review where I went back and I took a look at the podcast. I actually have 55 podcasts on that. I released one every single week. And I also, just went through the topics of the ones that
Great.
were downloaded the most. And of course, the one that was downloaded the most was the intimacy episode. Everyone wanted to know what that was about. I'm proud to say that I have over
Uh-huh. Yes.
35,000
Yep.
downloads. And I think that that's pretty, yeah, for my first year, I thought that was pretty good. The
Fabulous.
reach is global. So I have people
Yeah.
in like Uzbekistan, in Russia, in Australia, in Austria, in the US, Canada, UK, India, Pakistan, downloading that podcast. So I'm really proud of it. And pretty awesome. Yeah. And so further down in the year, I started to
It's
focus more on
amazing.
sexual health. And so that's where I had the leaders in sexual health, where I have Dr. Uloko,
Hmm.
who did the research on the clitoris. And then also I have Dr. Samina Rahman, who also does a lot of research and
Hmm.
is part of ISHWISH, which is the International Society for the Study of Women's Sexual Health.
Hmm.
And so, yeah.
Women's health, yeah. Great, great. Yes. So, I mean, I've listened to a few of your episodes. Such great information. For those who are watching, listening, I would highly recommend that you subscribe to the podcast and listen to it. Such, really great information for everybody. And I also know that you're a sex coach. So tell us a little bit about
Yeah,
that,
thanks. So I
and how people
well,
can find you as
first
well.
I'm a board certified OBGYN, and so I'm still practicing obstetrics and gynecology. But yes, I am a sex coach. I received my degree for coaching through Rutgers University, and then I did extra. I'm actually in the process and I'm almost complete with the sexual counseling and educator track through the University of Michigan. It's a whole course basically on sex ed. So it's like comprehensive sexual education. And I just felt like, just like we talked about, is, obstetricians, gynecologists, we just don't get enough information about sex and
Hmm.
sex counseling. So that's the reason why I did that. And I'm an intimacy coach just because I feel that, so many of us have negative beliefs and things that, like you talked about, we internalize, and only when we talk about them and work through them can we move forward and enjoy a life of pleasure and intimacy with our partners.
Hmm.
So you can go online. I
Yeah,
do have a
great. So
website.
where
It's
do people find you?
drsadaf.com. And I'm on Instagram and TikTok. So Instagram, it's a Dr. Sadaf OBGYN, and also TikTok at Dr. Sadaf OBGYN. And also, like I said, on YouTube is my podcast. So you'll find that Muslim Sex Podcast on YouTube. So yeah.
Fabulous. This was so much fun, packed with great information, applicable information. Thank you so much for coming on and sharing your wisdom, your knowledge, and your expertise with us. And for anybody who is watching or listening to this later, please comment below if you have any questions that we could answer for you. And once again, thank you everybody for coming on to this IG Live,
Yeah.
and thank
Thank
you so
you.
much,
Thank you so
Dr.
much for
Sadaf,
having me
and
on. I really
we'll
appreciate it.
talk to you
So
later.
thanks a lot. All right. Thank you.
Absolutely. Okay.